So, Kristen, why don't we just start by introducing ourselves and we'll go around.
Great idea. So, hi, friends. I'm Kristen Cooley, and I am the program director for the Giving Voice Foundation. Also a clinical social worker, so I come bearing my social work expertise today.
I'm Christian Gosvick, and I'm one of the co-founders of the Giving Voice Foundation and also a local primary care physician.
Do you want to say anything about your specialty with your physician practice?
So I focus specifically on LGBTQ health and geriatrics, so two kind of niches.
Yeah, awesome. And I'm Krista Powers. I am the executive director of Giving Voice Foundation. So today we're sitting in this beautiful space together. It's interesting because the three of us don't usually get together to visit, right?
True.
We usually have a meeting, an agenda, a program that we're working on. So this kind of feels a little bit awkward and super nice to me.
Yeah,
anyway.
We have an hour to chat.
Yes. So I'm just, excited to take up some space and talk about Giving Voice Foundation. So I think perhaps the best way to start is, Christian, to just hear from you about how did Giving Voice come about? And feel free to give all the details of the history as much as you would like.
I think the three of us crossed paths initially when I was in college and did a fundraiser for dementia and Alzheimer's back then. And I think in some ways, maybe that's when the universe was like starting to conspire to put us together for something. Yeah. And so time passed. We started the fundraisers. 2016, the first fundraiser, kind of just not knowing where things would go, and really just looking to connect people, bring people together, kind of get the community behind something that we all had seen the devastating effects of, and make something positive out of it. And I don't really know that any of us knew kind of where that was going to go. But the fundraiser grew, the excitement around the cause grew, the people involved kind of got better and better. I think we probably all three say all the time, like the people that are part of this make it just amazing.
Yes.
Yeah. And so it just every step of the way has kind of felt like an easy next step, a natural next step. And like, of course we would do this, and of course we would do that. And so I think as Mimosas for Memories grew, then there started to be, I think it was first Kristen that kind of came forward with like, well, we should do this purposeful planning program, and we should really find a way to connect folks in the community with the resources that we know are here and guide them. And I think in a lot of ways, that's what kind of like started to lay the foundation for the nonprofit. And from there, really kind of thinking about like, are there other ways we could get people involved? And are there other things we could do? The collaborative certainly, I think, was that 2020 when
Yes.
I feel like that's where things really started to dream. It's like the fundraising event, Mimosas for Memories, was there. And that was kind of our foundation, the base, and the need was there, right? And so then it was the three of us kind of being brave enough to say, okay, the money is here, the need is here. Should we go for it?
What are we going to do?
Yes. Kristen, do you remember, my memory of this, correct me if it's accurate, is Christian reached out to you and I and said, hey, we need to do something. And it was in the middle of the pandemic. So it was 2020. The best of my recollection, it was like springtime of 2020. And it had been a little bit of time since the three of us had connected, and we got together on a Zoom and just brainstormed and really brought forward, like what were the gaps that we were identifying in the community through your practice and mine as well. And we decided to create the collaborative, the Giving Voice Collaborative. Kristen, do you want to share a bit more about what that group is?
Yeah. I mean, in simple terms, it's a group of super passionate people, right? And that's what it started as, was us just, again, recognizing, okay, we had these funds from the Mimosas for Memories and Brews for Brains, and we recognized some kind of gaps in services in the community. And so we started reaching out to our buddies in the community that we knew were passionate about older adults and people with dementia, and said, hey, do you want to link arm in arm here and start rebuilding and growing some of these programs? So it's evolved now. We have 12 20 to 30-ish professionals in a variety of different expertises. So we have obviously physicians, social workers, local nurses, placement specialists,
death doulas,
elder law attorneys. We have a little bit physical trainers, right? We have a little bit of everything in there so that we're getting a lot of different perspectives.
Yep.
And it's neat. It started as a roll our sleeves up, right? And let's start some programs here. And I feel like it's so cool to see how it's evolved to staff members now as part of the Giving Voice Foundation, to where it's almost now an advisory board that we've figured out what works. And now they're here to make sure that everything that we're doing is with incredible integrity and quality and all that jazz.
And I almost think it was one of the silver linings of the pandemic, because I still have the screenshot. I remember we were all on Zoom for that first meeting. There were like 20 or 25 people that showed up. And I think if we weren't all craving that connection so much, that we might not have been able to harness that passion in the same way. And so while the pandemic was a challenging, difficult time, I think that is one good thing that I feel like kind of came out of that. And I look at that screenshot of all of us often and think about, oh my gosh, how far we've come since then.
There was so much energy, and you're right. Everything to me, Giving Voice Foundation is about connection.
Yep.
That is the foundation piece of what we are. And so the collaborative, being together on Zoom, we're just these hearts and these expertise ready and willing. And Kristen, you always say link arms, and I picture that, right? Like I have a visual around that of we're all arm in arm, skipping along together. You know, sometimes it's easier, sometimes it's like roll up our sleeves. And the collaborative, really, we said from early on, we're a group of doers and dreamers, right? We wanted people both who would get busy and get to work with us and create something. We didn't even know what that something was. And also people who had dreams around what do we need to do in our community in the tri-state to serve the aging population and people especially impacted with Alzheimer's and other forms of dementia. So yeah, what a great team. Would either of you like to talk a little bit more? And there's so many ways I want to go in this conversation. So I feel like we might be planting some seeds and come back to some things. But just on the conversation of connection, can each of you just speak to how that serves as a foundation to giving voice?
Sure. You want to shine first?
I remember, so one memory I have from kind of the beginnings of the foundation was we were working with someone to kind of build out our logo and the name. We hadn't even come up with what we were going to call this yet, and kind of had this concept around what we wanted to do. And the three of us had talked so much about what we saw the future of it being like. But I remember sitting on the floor of my living room with Kyle, who helped with our initial marketing plan and kind of logo and brand development. And just, we had a whiteboard like propped up against the fireplace, and we're like writing down words and thinking about like, how do we think about what this means? And I think the one that kept coming to the top was always connection. And it was, the events were about connection. The programming we do for folks is about connection. It's about connecting people with resources. And really, I think I've said in multiple remarks I've given at events before that I think it's that really the power of human connection that makes change. And I think every good change we see in the world comes from people connecting in whatever way that is, to solve problems, to lift each other up, whatever. And so I think always kind of bringing that back to connection. It's so easy in some ways, because everything we do is like, yeah, of course that's about connection. That's how we make things better. And so I think it's just this natural thread that has stayed woven through everything we've done. And we probably all three have different perspectives on how that looks. But yeah, it's been really cool to watch that kind of be our constant guiding light.
Beautifully stated,
right?
Like
follow that, Kristen,
build off of that, right? I mean, you stated it so beautifully, and I feel like I'm coming from the programming lens, right? As the program director, so much of what I'm doing is interacting with the folks that are in it, right? That either have a diagnosis of some form of dementia themselves or their caregivers, and I feel like, again, connection. it's at the heart of it, right? One of the very first things that they teach you in social work school, if you're going to be a counselor or support group facilitator or any of those things, is you got to build rapport and trust, right? And with that comes connection. And so that's always kind of been in my core there of building everything upon that. And my gosh, one of our programs is even called Creative Connections, right? Where it's utilizing music and movement in order to foster and build connections for folks that may not otherwise have ever been together in a room together, right? So,
Yeah. So my background educationally is also social work. And I typically through the years, all my career have done the macro practice. So a lot of fundraising for nonprofits. And my most recent career shift was into coaching. And so when I think about taking all of my background and work, and especially at several years of coaching, the gift of connection is precisely what allowed me to build a business, for me to help people build their own whatever, fill in the blank, right? And so to bring that and to know that that is central to what Giving Voice Foundation does, I've seen it in every aspect of my own life, so I think it's an easy thing for people to understand. And so then, how do we help it come to life with our work? So
and to me too, when we're talking about people going through a really scary progressive disease journey, talk about feeling totally on an island by yourself, like no one would understand. So connection feels so far away. And so to be able to bring people together in these group settings and fun settings, actually, you would never put the word dementia and fun together. And certainly don't want to minimize the seriousness and the awfulness that goes along with the disease. But it's really been such a gift to see folks going through some of the probably most awful times of their life, yet finding some connection, finding friendship, finding a safe space. Gives me goosebumps, you guys. That's what it's all about.
Yeah.
And even I think about just on the side of like building out the nonprofit, the web of connection. If you start thinking about like, Candace, who does our PR, and how did we get that connection? And then how did that lead to another? And that kind of web that you build of people that have supported and lifted up and brought their passion. And it's kind of cool when you like zoom out a little bit on that and really look at like this web of people that has sort of fostered us becoming what we are.
Yeah. I looked at data from 2024 and we had over 40 community partners. So, whether that was a sponsor or helping with programming, we think about Christ Hospital or Episcopal Retirement Services or the Opera, right? And those are just a few, and we have dozens of those. And so maybe if we go down the path of talking about our programming and just start to unpack that a bit, because we currently have 7 programs that are alive and active.
Well, I feel like first program, which Christian kind of mentioned this off the get-go, is Purposeful Planning, right? That was kind of the first to be born from the foundation. And it's probably the most clinical program that we offer. So I'll start with that.
Great.
Okay. So Purposeful Planning program, talk about a mouthful, right?
You made the name.
I did make the name. Why did nobody give me a little advice that the PPPs? So it basically what it is it's an opportunity to meet with a clinician, meet with a licensed social worker, and really dive in, roll our sleeves up and learn what situation are you going through. So this is intended for, again, individuals that have some diagnosis of dementia or care partners. And, all things talking about dementia education. How do we change the way we communicate with our loved one as their disease progresses? What can we expect? What symptoms are expected as the disease progresses? Is this normal, not normal? I feel like, in the doctor's office, my gosh, and Christian, you can speak to this. It's like you get this amount of time
tiny,
to throw out a diagnosis, do your assessment, and then off you go. And so I think the whole role of the program is to then pick up the next step, right? To really expand on the things that you have started your work as the physician, and then really connect them yet again, connection, right, with community resources. So lots of care planning. So okay, what resources would be helpful right now? Who would be helpful to get in touch with? An elder law attorney, a financial advisor, this placement specialist, or a speech therapist, or whatever it may be, right? So it's connecting them to what resources are appropriate for where they're at in their disease journey. And then also from there, helping them prepare for what's to come too. So they walk away with an action plan chocked full of all sorts of resources so that, again, it feels like they're not just spinning out of control. There's a toolbox to kind of carry along with them.
Yeah. Christian, from a physician perspective, can you just speak from a different lens about Purposeful Planning program?
Yeah, I think like Kristen said, it's one of those pieces that it sort of slots in as part of the team. And I think taking care of older patients, especially older patients with some form of dementia, is definitely a team sport. And having a trusted resource that we know I can send this family to the Purposeful Planning program and know that they're going to get connected with what they need, because there's such kind of strong time limits in the office for primary care and for a lot of geriatricians. So I think, what I've heard in the medical community is just such appreciation for a useful and quality resource that they know they can depend on to be part of that team and kind of get people on the right track. And I think what we even see in the feedback we get from that program is just this theme of like relief and a weight being off, just to know and have a plan and be pointed in the right direction. I think it makes such a big difference. And when people come back to see me in the primary care office after having been there, it is always sort of this sense of like, well, now I have a plan. Now I know what I need to do. It certainly doesn't make the journey any less difficult, but I think it makes it a little less daunting when you feel like someone has listened to you, heard you, validated what you're going through. And kind of helped point you.
And it's interesting too. Thank you for saying that. My goal too is continuity of care, right? Our healthcare system, it's so easy to get lost in the hustle of it all. And so even those action plans that we're drafting up get sent back, if the family wants them to, or the client wants them to, get sent back to the physician's offices and whatnot. So again, we're all on the same page of what are the recommendations? What are our goals here? So that's huge too. But it's interesting. I feel like some people that actually have the diagnosis themselves, you picture the caregivers coming in and learning all these strategies and resources, but we don't picture sometimes the person with the diagnosis sitting in there hearing it. And it's interesting how often they will verbalize, I feel better. I think sometimes the unknown, we can go down the rabbit hole of worst case scenarios. And so I think sometimes it almost gives, again, not to minimize, this is an awful disease and it's progressive, but my hope is that when they walk out of that purposeful planning, that they have some hope of knowing they still get to have a wonderful quality of life despite their disease. And here are some ways of doing that.
As I've looked at some of the data, right, on the back end, there have been over 600 purposeful planning programs since its inception, right? And so you think about
families,
600 families, right? And I wanted to talk about like, at times, multiple people come in for the Purposeful Planning program. And so the ripple effect, and you've even served people in other states, right? Because somebody might have an adult child living across the country or, siblings.
Yeah, it takes a team, it takes a village, right? So back to connection again, that word that, it's not just meeting with the primary caregiver, the spouse. A lot of times we have the whole family sitting in there. And sometimes it is meeting with just that individual person too, and maybe having follow-up sessions that we pull additional neighbors or friends and family into the mix. So my thing is, I always tell families, I get to be your buoy. We're not here to take the place of ongoing therapy or counseling, but we get to be a touch point for you as the disease goes on. And I think that can be a relief too, is people just knowing they have a point person if they don't know where else to go.
Some of one of the most powerful pieces of feedback that I read from somebody who did a survey after experiencing purposeful planning was that it provided them focus and helped them to understand what was a priority for here and now versus just kind of that spin out sort of that can happen easily with a diagnosis, right? So to have focus and step 1, step 2, step 3, like some little action is just so grounding for anyone.
Yeah.
How much, I want you to just mention, I know the answer to this, but I want you to speak into how much does this cost for a person?
Let me tell you, Krista Powers, it's free. How about that?
How about that?
And thanks to the fundraising events that we do, right? Mimosas for Memories and Brews for Brains. And as we've grown, we've gotten the opportunity to tap into some local foundations and grant opportunities so that we don't have to charge. I think all of us can speak to this, never want a financial strain to be in the way of people getting the support they need. So, to be able to take that off the worry list is
there's
awesome.
there's too much in healthcare that's inaccessible because of cost. And so I think this is something that it feels good to know that we're not going to have to jump through those hoops and people can just get what they need and we can take care of them.
Yep. People will be like, so how do I pay you? And I'm like, you don't.
You're like, bring in the hug. Not required, but
pay with gratitude.
Yes, exactly. So I would love to chime in about other programs.
Absolutely, please.
So purposeful planning is always our first step, right? And within purposeful planning consults, so often we're sharing about some of our other programming too. So our next big program that we offer is called Creative Connections, which I briefly mentioned before, but it's a weekly program where there's kind of two parts to the program. And one part, there's a local music therapist and a movement instructor guiding a group of 20 to 30-ish people with dementia through some music and movement. And while that's going on simultaneously in another room, as you guys know, there's a caregiver support group so that the care partners can get a moment to catch their breath, a little respite and relief, and connect with a local professional that's facilitating the group along with other caregivers. So such a neat program. You can feel the magic of it when you go and experience it.
I've struggled to put that into words, but I always tell people, I'm like, there's just something about being there and seeing that happen that it always like either gets my emotions or gives me goosebumps. And you just see these like little moments for people of like maybe moments of clarity or moments of normalcy or moments of connection or whatever it is. There is something about the energy in that particular program that is very unique, and I don't think you can quite put words to it unless you've been there as a volunteer or a participant.
Yeah. So whoever's watching, come visit, come check it out. It really is. It's a feel good, right? And again, I think it's safe space, right? Where they don't have to worry if they forget a word or don't remember someone's name, because guess what? We all wear name tags so that we're taking that worry off, right? And so they get to be, it's kind of an invitation to be silly too, right? Which everything is so serious nowadays. So I feel like that's nice to just open up the opportunity to be silly.
Well, and the gift of music and movement, there's so much science around this that it moves a person out of their head into their whole body. Yep. And so that is the gift and the science of this program that helps a person to come and be and to not be stuck in, am I remembering something? Am I doing the next right thing? Am I? And having this stress that does weigh a person down, whether you're a caregiver or living with a diagnosis, and you just get to be a human being, not a human doing, right? And so it is beautiful. We've been fortunate to have a lot of our friends through local news stations highlight this program. And so our website has some little clips, though there is magic in being there for 90 minutes and just immersed. Whenever I volunteer, I walk away a better person. It's one of those moments where it's like, I'm there to volunteer, but
we're getting more.
You're getting something too.
Yeah,
exactly.
It's an extreme moment of presence, I think, for everybody. You're just really like there in that moment. And
I'm glad you brought up the science of it too. And maybe Christian, you want to speak to it too. But our good friend Mike Gelfgott from Activate always talks about neuroplasticity, right? And the whole idea of our brain is so incredible that it can create these new neural pathways. And so I always tease folks. I'm like, you think you're coming and just singing singing and doing a little bit of movement. But when you're doing these dual tasks, right, when you're singing a song and marching in place or whatever it may be, your brain is doing some really incredible things too.
Yeah, I mean, it's exercise for the brain in some ways, and certainly not that we're reversing or changing the course of this disease, unfortunately, but sort of strengthening the connections that are there, reinforcing memories that are intact. And I think that comes out in lots of our programming, is this kind of dual action, something cognitive with something physical, or something art with something music, kind of that ability to use both sides of the brain, encourage those connections, and get people into a space where their brain's kind of doing something normal and healthy.
And the National Institutes on Health did a study, and they were able to show and prove that social connection, so beyond even the music and the movement, social connection improves all aspects of health. So you think about mental, physical, emotional, spiritual, right?
Yeah.
Like all of it.
One of the big things that sadly came out of the pandemic was really good data on social isolation, because I think we probably all heard the stories or have family members who were in assisted livings or nursing homes, and they were truly, some of them, isolated by themselves for months at a time. And that showed a progression in cognitive decline that we had not seen before in that population. It showed an increase in negative health outcomes, an increase in mortality. And I think we can point that back to, one, the importance of social connection. Again, the theme of connection, and also the importance of family members as care partners, and kind of often the front line to call things out and encourage progress. But yeah, I think one thing that has come out of the pandemic is a lot of research around social isolation and connection. And I think you probably can speak to this better, but some of the sort of like community building you've seen in these creative connections groups, and kind of how that's led to connection outside the programming even.
Which, talk about the magic. I feel like, that's like where I just want to take my badge and go with it to go home. So proud when you see genuine friendships grow out of this, right? Like, it's so cool to see that fostered and grow. So
what does that look like? Because I know you have, like, of course, without saying any names, but you can give some examples of what does that look like for people in Creative Connections?
Well, I will say, I think the fact that it's a weekly program is what makes a difference. There's a lot of programming out there, which thank goodness there is. And I'm so grateful for so many of our community partners that are offering so many other cool things going on. But there's something to be said about consistency, right? That you're seeing for the caregivers and the participants themselves with the diagnosis, that consistency, you start to get to know people beyond a kind of surface level, polite, and our little manners, right? So that's where you start to see vulnerability and people really getting to know each other below the surface. And so what that looks like is friendship, right?
Yeah.
That they're getting together, they're going out to dinner, they're inviting each other to one another's homes. We're getting invited to little gatherings and get-togethers and whatnot. And that's the beautiful thing, is that they're creating a village with the program is the foundation that helped that
so
happen.
Cool. I love when ripple effects happen. And this is like the ultimate ripple effect, where we all came together and offered a program, and it has become so much bigger than what the professionals could bring, the volunteers could bring. It's the people co-creating and coming together to create something much bigger than any one or two individuals could do.
Yeah, that's so true. And the program is growing too. So it started, with one location, and now it's evolving to where now we have 4 locations and growing, right? And there's a lot of amazing spaces, churches, community centers that are chomping at the bit saying, we want it to come here too, which is awesome.
That's so cool.
Can't grow quick enough. So,
and before you say move to share about another program of ours, I do want to just mention about volunteerism with Giving Voice Foundation. Creative Connections relies on volunteers. So can you speak into that a bit?
Us three can't get to all the places, right, as much as I would love to. And so again, consistency, right, is so important, and routine. So what certainly we're learning as we go here, but what we've learned is that consistent volunteers make all the difference, because they get to know these folks and the quirks and the needs and the different things and personalities. So yeah, I'm so grateful for our volunteer group. And it's way more than volunteering for them. I mean, again, we talk about connection. They start to become connected and build friendships and care for these folks too. So,
family of choice, right?
Yes, yeah.
So another little data nugget, in 2024, we saved $85,000 through volunteerism. So you think about that. Some nonprofits, that's their entire budget, right? And that's what we saved as a result of people sharing their time and coming and being present at these programs. So it's incredible. And I only see that growing.
Yeah.
And I think, like we said before, even, I mean, I think the volunteers are getting so much out of it. It's even, I mean, my mom actually volunteers. And so she always has stories of, you know, things that have happened and connection that she's seen. And I think that people are able to take something away from it for themselves. So maybe it doesn't even feel like they're, you know, signing up for a job.
My mom volunteers too.
Yeah.
My mom's out of town, or she would, okay? Come on.
No excuses. Yeah.
No, it's really neat. And it's neat to see the variety of volunteers too. So this isn't just, and my gosh, we're so grateful for the occupational therapy students or the med students that are coming and getting some experience so that they can carry on, which is neat to see too, that they're getting this experience to take with them as they grow in their professional career. But it's also really neat to see the retirees, to see someone that maybe lost a loved one from the disease that wants to use that knowledge that they gained unwillingly, right, to pay it forward. We have intergenerational, even my little daughter and her buddies and some kiddos that are on Christmas break or summer break will come and volunteer. It's really, sometimes there's just not words to describe it. It's really special.
And I think those, I mean, I think just anecdotally, other folks I've met who work in the geriatric field, almost all of them have had some sort of like early experience with older adults or some experience with older adults along their training path. And I think a lot of times for people who haven't had that experience, the thought of like a nursing home or someone with dementia who you might not know what they're going to say is a little intimidating.
Yeah.
And so kind of bringing those walls down, having people in this environment, like you said, the opportunity to like be a little goofy or silly, it makes everybody more human. And I think it's seeing that humanity in this group of people that makes you feel passion, compassion, empathy, whatever word, for them. And I think in some ways that's another piece of service that Giving Voice is doing, is sort of exposing people to this disease in a positive way to hopefully impact their career. And I mean, I hope some of these OT and PT folks and some of these med students are rethinking, like, what do I care about? What am I passionate about in terms of what my future practice or job is going to look like because of this experience? And I think we've seen that in feedback we've gotten from
1,000%, to the point that literally we have a med student who's getting her master's in public health now that came to one Brains in Bloom, which we can share about that program too, one Brains in Bloom program. And as a result, she wanted to do her practicum with us. So it's so cool. Yeah. Again, that the energy and the magic is palpable. You feel it, right?
Well, and beyond our programs, just what you were saying is really, can we chip away at the stigma, right?
Yes,
One of my lifelong goals has always been around aging in the US and how do we view it as a society? And, you know, it's often just kind of push it into the corner and don't look at it and, you know, don't touch it and don't talk about it. And this truly brings color and light and connection and like real humanity that allows it to be palpable and available and accessible.
That even though someone has a dementia diagnosis and we assume, oh, they must not know anything, they don't remember anything, talk about totally erasing that stereotype when you get to sit next to someone. And even though they may not retain the conversation, the amount of insight and eloquent statements that come out of some of these conversations.
quotes. Yeah. Oh my gosh. The things you hear people say, funny, silly, serious, insightful. That is a really cool part of working with these folks.
That are like, I better write that down because that is like a gold
phone.
nugget. Yeah. So, Kristen, talk about whichever program. I'm kind of thinking Brains in Bloom.
Brains in Bloom. I kind of dropped a plug for that one tonight. So Brains in Bloom, it's really kind of neat how these programs happen. So I was doing a purposeful planning consult. This is several years ago now. And at the end of it, the guy who was taking care of his wife was like, I have a friend I'm going to connect you with. His name's Dan Druffel. And I'm like, okay. And I'm thinking, okay, does he have the disease or is he taking care of someone? So this Dan Druffel ends up calling me, and I'll never forget, I was giving my child a bath at the time. And I'm like, who is this guy? What's happening? It was like the most unprofessional moment. And this beautiful program has developed as a result of it. But I guess the point is one connection out of purposeful planning evolved into this program. So Dan Druffel is a local retired landscaper who bought a plot of land in Walnut Hills and created Druffel Gardens, which is a local nonprofit community garden that they do some produce, but primarily are growing flowers and then donating those flowers back to local organizations, hospitals, hospice agencies, and whatnot. And so this amazing man that I did a purposeful planning with saw an opportunity there for us. And thank goodness he did. And thank goodness I answered the phone despite my daughter getting a bath, right? Because here we are. But
answer the call.
Yes. But how it's evolved is it's a monthly floral arranging program. So Druffel Gardens donates all of the flowers from their gardens. And once a month we come together, thanks to, again, another amazing local church that allows us to use their space free. And we come together for a floral arranging class. And Dan and some of his amazing volunteers, some of which are master gardeners, guide the folks through putting a floral arrangement together, which again, we talk about the science, right?
Yep.
Yes.
That we see it as just this cute program, social isolation, getting people together, but there's science behind using your hands, the dexterity, the hand-eye coordination, and how that can stimulate and help the brain. So it's cool to see these light, airy programs really doing some cool things behind the scenes.
And in addition to that, I'm glad you talked about even just that fine motor dexterity. There's also this like really neat thing that happens. So through Brains in Bloom, people go home with a floral arrangement, and sometimes they go home with even more than that and can gift it to someone else. So this dynamic of allowing a person to have purpose and meaning and to hand them something to create connection with someone else, a neighbor perhaps, or a grandchild or whomever they might interact with once they leave the program, and to give a floral arrangement to, right? That feels good to gift someone. And so to have the opportunity that without this program wasn't happening.
And then those are sitting in someone's house for a week or 2 weeks. And every time you pass them, you're thinking about kind of that experience, that connection, that person. And so it really, I think it's, again, that ripple effect that like really kind of blooms or blossoms out of
Yes. Oh my gosh.
I couldn't resist. I could not help it. I tried to hold it back, but it just came right out.
No holding back.
Well, and the beautiful thing is, again, it's evolved. So it started with us just offering it during the summer and spring months when Druffel Gardens obviously is growing their flowers. And it's evolved into a local Cincinnati wholesale florist hearing about the program and wanting to continue it during the winter months, which talk about, again, the moments when we're most isolated, that seasonal affective disorder when it's dark and gloomy and whatnot. So to be able to offer at least once a month that little bright spot is amazing too. So, yeah.
Wonderful. What else is happening through Giving Voice Foundation?
What else is happening? So we got Creative Connections, we got Brains in Bloom, we got Purposeful Planning. So shall we talk about ballroom dancing?
Yes.
Yes. That.
So one of our amazing collaborative members connected us. She was doing some ballroom dancing classes and said, I think this gal would maybe be a good, yet again, just a random recommendation evolves into these programs. But Mary Ramirez Cook is a local ballroom dance instructor and owns her own dance company here locally. And she has a son with Down syndrome. And she, for years, has done programming for individuals with intellectual disabilities and Down syndrome, and still does beautiful programs at her dance company. And we connected with her and said, I think this could translate, right? I think what you're doing with those folks with intellectual disabilities could work for our people with dementia too, who, can't follow the multiple steps. So how do we simplify a ballroom dance number here into something that someone with dementia or memory impairment can do? And it's really beautiful. And talk about volunteers again too. Mary Ramirez Cook has the most dedicated, amazing volunteers. So she has probably equal number of volunteers as participants, which is really nice for a program like that. So we have a full dance floor, right?
Nice.
And there's people to guide you through it so that you're not out there on the dance floor, 2 left feet, right? They're there to kind of walk you through and have fun. My thing too is I want especially in a spousal situation, for them to still have moments with their spouse that they can treasure and aren't the caregiver having to feed them and give them their medicine and It's they actually get to just dance with their wife again, right? Which has been really special to see.
Like I can just feel, I can feel that just like saying that.
Yeah. You see it on their faces in those videos. When you get little clips from that, it's just.
And let me tell you, I've now learned how to Roomba, guys. And something I never thought was going to be on my social work resume, but here we are.
And who knows what else. Yes.
So we have that's called Dancing to Remember. That usually, and again, with one of the things I love about social work and giving voice is collaboration too. That, we talk about connection, but for me, it doesn't have to be that Giving Voice's logo is on everything, but that, okay, if there's another agency that's game and passionate and wants to do it together, and that can allow us to do more sessions or more locations, well, what a win, right?
Yeah.
So thanks to Episcopal Retirement Services and some other amazing partners, we're able to do just that. So it's now a series that's not just happening once a year, but usually at least twice a year. It's usually for a full month and really, really special. So another program that's similar to that is a partnership with the Cincinnati Opera. So that's called Music in Motion. And similar to Dancing to Remember, it's something that we usually offer a couple of times a year, usually when we're on break in between sessions for Creative Connections. It gives an opportunity if people still want to get together. And the Cincinnati Opera just does such a beautiful job. So it's basically bringing these incredibly talented opera singers to our folks, to the community. So we get a front row seat at these incredible musicians and singers. And then there is the most hilarious, she should be a comedian, I swear, but she's a yoga instructor that they, similar to Creative Connections, they kind of weave in and out of music and movement. And that was very intentional too, because at Creative Connections, the person with dementia is getting to experience the music and movement, but their caregiver is in the other room having the support group. So rarely do they get to experience the music and movement. So offering Music in Motion, this opera yoga series, it offers the caregivers the opportunity to experience a little bit of what their loved one gets to experience during Creative Connections.
Yeah, it's really cool. I love when I've been to this to Music in Motion. It's a large room and it's full, and it's really kind of neat to stand in the back and just watch everyone moving and to watch the opera do their thing. And it's a special. I mean, all of these are special programs, but yeah.
And again, I think that was someone had randomly connected us with somebody at the opera, and then they were interested, and it's just these little seeds.
Yes.
Which is core to our mission. The first part of our mission is to inspire conversations and connections, because through conversations come the connections, come the programs that improve the health of older adults, right? And that serve real needs in the community. So it's core to who we are. So I'm going to have you mention our last two programs, if you will, Caring for the Caregiver and the educational workshop. And then we'll talk just a bit also about some of our events.
Awesome.
Sounds good. So Caring for the Caregiver is a guided writing workshop. So there's two local authors in town, Pauletta Hansel, who was Cincinnati's first poet laureate.
How cool is that?
That's cool.
You guys.
That one, who she is as a human, and two, that she is partnered with us. Like, I feel so proud.
Super cool. And then her fellow author is Annette Januzzi-Wick, who equally so incredibly talented. Yep. Both lost their mothers to the disease. And so obviously have a very direct impact and connection and want to give back as a result. There is something, I feel like I keep saying this about all of our programs, but there's something really raw and magical and neat about this program. So it's interesting. I am not a journaler by any stretch of the imagination. And somehow I'm the one that gets connected to this. I'm like, here we go. But it's neat. As someone that has no background in writing, they give these beautiful prompts and ways to dig below the surface. So it's a neat opportunity for folks that maybe aren't verbal processors, but need, or frankly, are journalers or want an avenue to process what they're going through in a different kind of creative lens. By the end of participating in a few of these, I was like, my writing's not too bad.
Yeah, look at that.
You know?
Yeah.
But in all seriousness, it is neat. I've had several caregivers like hold on to their poems or turn them into bookmarks or include them on a Christmas card. So there's really, it's called beautiful sadness, right? That what we're going through and what they're going through is sad, but to be with someone in that rawness and that vulnerability, there's something really beautiful about that and capturing that. Pauletta and Annette do it so beautifully. So that happens 4 times a year. A couple of the sessions are virtual, so we get people from out of state that participate. And then 2 are in person, which offers just a different feel.
Yeah. Sure.
Yeah.
And again, that's for the caregivers.
That's for the caregiver. Yeah. Yep. So the last program that you mentioned, it kind of evolved as we had started some of these programs, Creative Connections in particular. We were like, you know what? It may be helpful for our volunteers and our facilitators to get the opportunity to dive into more education about the disease if they want it. And what we learned is they do want it. And so we now have an annual dementia, music and movement education workshop. It's an all-day workshop where we partner with the Association for Professionals in Aging and are able to offer continuing education to folks, and it's really neat to see how that's evolved.
It's grown so much.
It's almost doubled year over year.
It started with like 6 of us sitting in a room.
I think you had like 80 or 70.
It was close to 80 last year, and Christian spoke to offer, education about the disease. We have a wonderful music therapist who gives some tips and tricks. So a lot of activities directors from facilities will come to garner new tips and tricks for engaging with their memory care units. It's really cool to see how it's evolved. And
it's just, I think everything you do, Kristen, is just such a high quality, just done so well to a point that I think we all feel very proud of everything that you do. And I think something like that really just speaks to, this isn't just about us creating good programming and impacting the people that we can touch, but it's about affecting the community. And I think that many of these people are coming and they, like you said, they work in other facilities, they provide programming in other venues. This isn't just for folks that work with us. This is, I think, an opportunity and an avenue to really hopefully change things for the tri-state.
Yeah. Well, thank you for that. Both of you as well. I feel like, to me, quality is huge, right? That I want to make sure, and that's one of the things. Yes, our programs are free for the participants, but I value the talent and the time of our facilitators, so they're getting paid for their services, and I think that makes a difference too. So, And
it supports people that are doing good work. I mean, these are people's jobs, and so I think that's part of it. I think The quality is great. I think from the start, we've been really intentional, and Krista's mentioned a few pieces of collecting data all along the way. So really just, I think everybody involved has done a really nice job of kind of making this mean something and really building strong foundation that has let us be strong as we grow.
When I was on the board and then transitioning into this role as executive director, what I share with people is this team is the most high integrity team of humans I've ever worked with. And it's both of you, it's our board, it's all of our collaborators and partners. And, when I think about high integrity and high excellence, it's making sure that we connect, right? And so again, just coming back to that foundational, what can be simple yet can be tricky in a very busy, noisy world, to make sure that we connect. So thank you for walking through all the programs. I feel like people don't know all of, just kind of peeling the onion and wow, there's more that I can get involved in. And so many of our participants do multiple of our programs, and they're grateful because it's a way to get out of the house. It's a way to connect with their loved one. It's multiple things to them.
Yeah.
So as I think about high integrity and high excellence, I think about high touch. And so as we're recording this, it's spring of 2025. So maybe someday in the future, somebody will be watching this. So just a little point in time reference, but this is our 10th annual Mimosas for Memories.
Crazy.
Yay.
Yeah. So I will say that you started this, and you mentioned this at the start of the conversation as you were a med student. Yeah, you did this.
Some funny stories from the beginning, I feel like.
Yeah. You started something that was a third-party fundraiser, right?
Yep.
And you raised $7,000, which is not something to sneeze at. $7,000 is significant.
Yeah.
And do you recall the number that we raised last year?
Oh,
I do.
I'm thinking,
127,000.
Yeah.
At this
Insane.
event. And so this is year 10. So talk a little bit about Mimosas for Memories.
Gosh. Mimosas has been now, I guess, part of my life for like a third of my life. So it feels like such a big part of me. And we always joke amongst family and friends, like, oh, we're headed into mimosas season. It's sort of like and
tax season.
And then mimosa season. And we talk about, it feels a little like we're having a wedding every year. It's like this. But when I think back to the beginning, I mean, I think it was truly like a little bit of burnout of medical school and feeling like, oh, I want to do something different. I want to give something back. And so I remember thinking about, well, I could have a fundraiser. And I think the person who maybe gets some credit for any of this happening is Peggy Marquette from the Greenwich House Gallery, who has sadly since passed away. But I probably called 20 venues and left voicemails and was like, will anyone let me host a fundraiser for free? Because I'm a medical student. I have no money to pay for it. And I just want to do something different. And I remember driving up MLK after class one day, listening to her voicemail. And she was just like, I got your message. And well, if you want to have something here, that's fine with me. I'll help you out. I think we have some tables. And so sure enough, I think, I don't know how many years we were there, 4 or 5 years, maybe.
I think so. Yeah.
And she was instrumental in her unique way in those first years of the event and really kind of making the space for something to grow. And I remember, I think you all were slinging mimosas.
We were the bartenders.
We've gone from bartenders to executive director, program director. Anything's possible, folks.
And I remember those first, 1 year, I think the place only had one bathroom, and 1 year the air conditioning wasn't working. And 1 year we're outside mulching at the last minute to make it look beautiful. And I think the fact that it got to grow out of that has sort of made it more special, and it's made it something that, like anything else that you've put your time and energy and effort into, for all of us, it feels like something that we're connected to. It's not just something we signed up to be on the planning committee for or something. It's we birthed this into what it is. And so I think, as I stood back at Mimosas last year, where we're now in the biggest space we've ever been in and had over 300 people there, and the mayor was there, and thinking about all of the things that have changed in the then 9 years and now this year 10, it's just kind of crazy that it has become what it is. But I think it's because it's kind of a fun, different event. I mean, people are chatting and connecting and talking and just the whole time sort of like engaging. And I think we've added our own little like flavors and twists and turns that make it unique every year. And I don't know, it feels a little like a party that is sort of like, in spite of you, terrible disease, we're going to have this great party and bring people together. And as more have engaged with the programming, we see participants from programming coming and being at the event. And it just really is a pretty cool experience.
Yeah. Kristen, any little nuggets on that
you spoke about it. I was just going to say that, at so many fundraising events, you're sitting at the table, you're hearing a couple of sad sob stories, and you're giving your money, and that's it, right? And it's still so important, but it is neat. Again, connection. It's neat to see all of these people from very different walks of life. We may have med students or physicians that know Christian, to literally some of my participants with dementia that are there and having fun, right? It's a very special event.
Yeah. So that happens the end of April every year. And our second event, Brews for Brains, happens in mid to late September every year. So do you want to speak about that a bit as well?
Another kind of came from connection. So my husband and I had gotten married at Wiedemann Mansion in Newport. We became friends with the couple, Donna and Roger, who owned the mansion. And at some point, she kind of learned what we were doing. And she was like, if you ever want to have a fundraiser here, that would be fine with us. And we had somewhere along the way connected with the Rouse family at Braxton Brewery. And they were like, we would love to help you guys. And so that, again, was just this sort of like...
Say no more.
We were like, we will make it happen. So I think only a year after Mimosas started, we started doing brews. Again, I think the first year, maybe we had 40 or 50 people there. So always a smaller event, but a chance to come together in the fall, a chance to kind of a bit more casual. And that event has sort of similarly grown and become a staple of what we do each year, and really just been kind of fun to watch the connections that come out of that event and see everybody brought together another time in a different venue. And again, have these amazing partners in the community who are like, yeah, I see what you're doing and I want to help what you're doing. And I think one of the really special things about Cincinnati that I hear it from other people that aren't from here, so I think that it must be true, is that people here are giving and people want to help. And if you just take the moment to take what you care about and share it with somebody else, I think most people want to help you with that. And so even when the world feels kind of crummy, I think if you just look for those other people that will want to lift up with you and really you're just vulnerable about what matters to you, people want to make a difference with you if you will let them. And I think we're fortunate to be in a city that is that way.
I like that.
Yeah, I feel like just kind of mic drop with that. And to just like give that space around, it takes dollars and cents to do our programming.
Sure.
And it takes partnerships. And I'm really proud of the creativity that we've all embodied throughout growth, that we've been nimble, we've been willing to listen and to dig in and to, ask some hard questions, and then to offer programs and services, and also then to receive. There's so much that Kristen, you as program director, you are giving. You are a generous person. And I do think that is one goal of Giving Voice Foundation, is to be a generous organization. We also are so gifted when we receive. I think that it just is a flow that gets to happen. And this is how people get to gift us oftentimes, by buying a ticket to an event or sponsoring an event, making a donation. These events make up a significant part of our program budget, which also I'll highlight, you've been committed all along, Christian, to being very transparent with our financial statements. And so people can visit our website. I guess maybe in the last couple minutes, will you just speak about, give our website, right? And Kristen, if you want to give our phone number. So I'm sure we'll also have this on a ticker tape at the bottom of this recording, though, just so that it's spoken, our website and phone number.
Yeah, I mean, I think our website's a great resource, givingvoicefdn.org. We try to collect the great stories that the local news partners have done about our programming on there. So it's kind of fun to watch through some of those, because they're really a good lens into the programming if you haven't ever been there. And like Krista said, I think one tenet from the start has been, we're going to be a transparent organization that is very clear with what's happening with our dollars. And those dollars will be used for local programming. And so you can look at our finances on the website. We would answer questions about those at any time. And we feel proud of the fact that what we do with the dollars that are generously gifted to us is making a difference. And so I think the website's a good place to see all of that.
Yeah. In addition to that, too, sponsorship packets on there. So if there's ever a local organization that's interested in sponsoring, that's where you can find information too. And something that we recently added to the website is information about planned giving. You know, as you were talking about the gift of receiving, one of the awful but beautiful things that's come out of our programming is people are touched by our programming. And so as a result, they're assigning their memorial donations to come back to us. So what a again, beautiful sadness, right?
Yeah.
So if people aren't wanting to get on the internet and would rather talk to a live person, our phone number though is 513-513-0GVF.
Yeah, thank you. So connection, creativity, light amidst something that's so hard. And, you know, I think we would all say we are with you to anyone who is going through this disease and this process. We are with you, arm in arm, available and ready and willing. So thank you both for the conversation today.
It was fun
this
to catch
was
up.
way fun.
We did it.
Yay.